My name is Megan Milne, and today I will be discussing our recent publication, Prostate Cancer Patients on Androgen Deprivation Therapy, Specialty Clinic Collaboration, and the Electronic Medical Record Can Improve Bone Health Monitoring. Prostate cancer is a very common malignancy among men. There are approximately 2.9 million men living with prostate cancer in the United States alone. Approximately 40% of prostate cancer patients will undergo androgen deprivation therapy, also known as ADT, as initial treatment. Prostate cancer patients on ADT are at increased risk of decreased bone mineral density and therefore minimal trauma fractures, also known as fragility or osteoporotic fractures. This is a side effect of chemical castration. Prior studies have estimated that approximately 3,000 excess minimal trauma fractures per year are attributable to ADT. Prior studies have estimated a number needed to harm for fracture on ADT as high as 28. Mortality risk is estimated to be approximately 40% higher when patients suffer a minimal trauma fracture after completing ADT. To address this risk, our institution formed the High Risk Osteoporosis Clinic, also known as HIROC. The aim of this clinic is to assess a patient's risk for minimal trauma fractures and osteoporosis, as well as manage these conditions. However, referral rates for prostate cancer patients on ADT in particular were low. A quality improvement initiative was begun to improve referral rates and ultimately bone health in patients with prostate cancer on ADT. The quality improvement intervention implemented a best practice advisory, or BPA, in the electronic medical record and conducted multidisciplinary provider education sessions. An initial chart review was conducted to measure baseline referral rates. Fishbone diagrams were constructed to reveal causes of suboptimal bone health management. A best practice advisory was created for gonadotropin-releasing hormone agonist orders in the EPIC electronic medical record to encourage referrals to the High Risk Osteoporosis Clinic. Discussions were held with urology clinic staff on fracture risk. Periodic chart reviews assessed referral rates. A final chart review assessed current referral rates, DEXA screening rates, and vitamin D rates in patients who received HIROC referral compared to those who did not. The baseline referral rate to the High Risk Osteoporosis Clinic from urology clinics was 4%. After implementation of the BPA, referral rates increased to 21%. Education of urology nursing staff regarding bone health in patients on ADT increased referral rates to 44%. It is important to note that the mid-level providers were responsible for placing ADT orders and HIROC referrals. The final chart review of 113 patients revealed a referral rate of 59% in the chart review conducted from 2017 to 2018. Further analysis of the final chart review revealed that 48 of the 67 patients referred to HIROC had a DEXA completed or pending at the time of the final chart review. 50 of the 67 referred patients had a vitamin D level obtained or pending. 7 of the 46 patients that were not referred to HIROC had a DEXA completed or pending at the time of the final chart review. Only 3 of the 46 patients who were not referred to HIROC had a vitamin D level obtained or pending. It is important to note that vitamin D monitoring is important on patients on ADT, as starting a bisphosphonate in these patients with vitamin D deficiency can lead to iatrogenic hypocalcemia. Of the 113 patients in the final chart review, 32 had received anti-resorptive therapy. 75% of these patients had HIROC referral, and the therapy that they received was either denosumab or bisphosphonate therapy. Therefore, 81 of 113 patients did not receive therapy. 53% of these patients had HIROC referral. Upon further chart review, the logistical delays were among the most common reasons why patients with HIROC referral were not started on anti-resorptive therapy, either due to clinic scheduling delays, awaiting DEXA results, or awaiting vitamin D results. In conclusion, the use of both an electronic medical record best practice advisory and interdepartmental discussions regarding bone health produced a sustained improvement in addressing bone health issues in men with prostate cancer on ADT. A higher proportion of patients referred to HIROC had bone health assessed with DEXA scan and vitamin D levels compared to patients not referred to HIROC. Prostate cancer treatment can and should involve a multi-specialty approach based on the results of this study. Thank you very much for tuning in.
Thanks for sharing that information. And I like the name of your clinic. That's very catchy. Question. One of the things that I think that's really overlooked a lot with men who are on ADT and older men is the effect of weight-bearing exercise and things like that. Do you stress that to the patients, or just go basically right to anti-resorptives and vitamin D and calcium?
Patients are also counseled on different lifestyle management in the HIROC clinic as well, including weight-bearing exercise is a critical component of that counseling, as well as dietary intake of calcium, and then supplementation of calcium and vitamin D as well.
Right. This is just such an overlooked area in prostate cancer. It's sort of, most urologists grew up, at least the older ones, with the main side effects of ADT being hot flashes. Now we realize that this is important, and that when a fracture occurs, femur or hip or things like that, that it carries a pretty high mortality rate. Did you have a question about your EMR? Was there anything that our audience can learn about working with EPIC and the EMR and some of the challenges to put this forward?
In terms of challenges with EPIC, I think that it's really important to have a good working relationship with the people who will actually be placing the order to make sure that it's user-friendly and something that they'll be able to kind of read through quickly but efficiently and understand the importance. I think that that's a really critical part of developing the best practice advisory, user-friendliness for sure.
Right. Anything else you want to add before we sign off?
No, thank you so much for this opportunity. I really appreciate it.
Well, we appreciate it. This is a very important sort of underserved area and androgen deprivation. And a whole group of us now are working on something on ADT education for patients and for urologists. And it's important that there's so many men on ADT, and also cardiovascular-wise too. It's a very new challenge. So anyway, thanks a lot, and have a good day. We appreciate it.
Thank you. You too.